In this video, we're going to look at healthcare assistance in BC and the various types of settings and environments you can work in and what you will do in your job as a care aide. So most HCAs work in residential care facilities or long-term or extended care facilities, but some also work in assisted living residences and in the community. And then there are also a small few that work in acute care, such as in hospitals. So one of the places you can work is for home support as a home support worker out in the community. This job pays about $19 to almost $21 an hour. It's going to depend on the health authority that you work in. And then if you work for a private company, I'm not sure what the wages are, but I would imagine it's a little bit lower than that, a little bit lower than that range. So your job with home support is you are going to get your list of clients for the day, you're going to get in your car, and you're going to go around to those people's homes. These are people who generally are quite independent. They're usually able to kind of get around on their own, but they need help getting dressed, they need help getting bathed, they might need help going down the stairs to put on a load of laundry, they might need help chopping vegetables because their arthritis is too bad, but they want to cook some dinner for themselves later. They might be somebody who needs help having a shower because if they tried to have it on their own, it would be dangerous. Sometimes there are clients who are palliative. So some of these people get visits 1 or 2 days a week. Some people are getting it 4 or 5 times a day. So it's quite variable. This is a job that is really enjoyable. You're getting to know people and who they are as a person. You're not just seeing them as a patient in the hospital in a hospital gown. You get to find out a little bit about that person's identity, which makes the job really enjoyable. So assisted living is very similar to home support. In fact, home support workers sometimes even come into these facilities. These are more like apartments or studios, and there are care aides working in the facility. There's also nurses that are on site. They can be very small or very large. They can be public or private. The wage usually ranges from about $16 to $19 an hour. The job is not as physically demanding as working in a residential care facility, but it's still it's actually a really nice environment to work in. So as you can see, this lady here just needs help getting in and out of the chair to make sure she doesn't fall. So sometimes they just need help being reminded to take their medication, and they might need help just getting down to the common dining room, where, by the way, the food is usually much nicer than it is in a residential care facility where they might be getting hospital food. So these places tend to be quite nice. But again, people are fairly independent. So in extended care or long-term care, this is usually an extension of the hospital. So you can see in this picture here, this is the hospital, and there's actually a tunnel that runs underneath to the extended care facility. These are patients residents, clients in the community, residents in residential care and extended care, patients in the hospital. So these are residents who are usually much more ill and have lost that independence when compared to assisted living. They often have multiple conditions or illnesses that need to be attended to, but they don't require them to be in hospital. They're people who, what we might call, are total care. So they are either in bed or in a geri chair of some kind, a geriatric wheelchair. In facilities, an HCA's job mainly consists of helping residents with activities of daily living, or ADLs, eating meals, and socialization. Although some residents are there because they can't take care of their own ADLs but are still cognitively fine, Most residents have some form of dementia. And as I said, many are total care and some are even palliative. So extended care and residential care, those are usually, they pay a little bit better. The job is very demanding. So the pay might be, let's say, $21 to $23 an hour. But I think that would depend if it was private or public. Some of the private facilities are run just the same as a public facility. The employees are part of the Hospital Employees Union, and the standards are the same, although standards can vary whether it's public or private. So some of these smaller private facilities, whether they be assisted living or residential care, they will hire people who are unskilled workers, and those people might only get $13 to $16 an hour. Although I do know some registered healthcare assistants who have chosen to work in those places for, say, $16 an hour simply because they like the residents, they like the workplace. But generally, these jobs are physically demanding but very enjoyable. So I'm just going to go over what a typical day on the job might look like. So in the morning, you're going to get to work. You're going to listen to report. That may or may not happen in a group situation. It might be one-to-one with the person who's leaving and been there all night. If you haven't worked for a few days, you're going to find out if any of the residents have been ill or if they've had a rough night with no sleep. And then you're going to plan your day with your coworkers or your buddy, and you're going to prioritize which residents you're going to see first, which of them may want or need to sleep in, and who's going to have a full shower or a bath that day rather than just a sponge bath. You need to find out who has appointments or visitors coming. And then you're just going to go and start getting people up, washed, groomed and dressed, and more often than not into their mobility device, like a wheelchair, and you're going to escort them to their table for breakfast. Breakfast is usually served to everyone at once, but it's going to be facility specific, so that's not always the case. But your day will usually be filled between helping people with more activities of daily living, getting them to the entertainment, religious services that are often on site, visits from family and friends or volunteer groups. Sometimes there's outings that you have to get them ready for. You're also going to be expected to provide comfort to residents who are feeling emotional, or maybe someone who's just lonely, and you might sit down and have a good laugh with them and listen to their stories of times gone by. You might even break up an argument between two residents, because a lot of these people have some level of dementia, but they're also just human, and just the same as us, they have needs, feelings, and desires. So you will also be reporting to the nurse anything that is of concern or out of the ordinary, and then the nurse will be providing you with direction on what steps to take next. You're going to be charting and documenting. You're going to help with lunches and dinners and snacks, and you're going to help keep the bedrooms and common rooms tidy. And in some facilities, you may even do some housekeeping. So one of the other jobs that you can do is working with activities or working in physio, but generally this would require another certification or at least a lot of experience. And this is a very typical situation here where everybody's sitting in a circle and this lady is singing. Sometimes there's games that they're playing. Sometimes people get up and dance. And that is the best part of the day and one of the most enjoyable parts of the job. So another place that you can work is in acute care settings. In these settings, nurses rely on HCAs to help lighten their workload or care for patients who may require one-to-one care. In other words, patients who would otherwise require physical or chemical restraints, and they bring in a one-to-one care aide rather than resort to that. So HCAs can work in numerous areas of the hospital, so emergency, cardiac units, or psychiatric units, but mostly on medical surgical units, which is just the area that you might go and visit your friend when they're in the hospital. There's also step-down transitional care units, rehab units. Those are, as the word says, a step down from med-surg units. These are people that are not quite ready to go home or go back to their assisted living facility. They've stabilized, but they're still in need of regaining some strength and monitoring. So there are definitely care aides working in this situation. So in acute care, the most important part of the job is to help the nurses do whatever they may not have time to do if they have a high patient load. The main priority is to answer call bells, toilet patients who require assistance, and help patients who need bedpans or who are incontinent. HCAs perform catheter care. They help with feeds. They stock up supplies. Whether you're working in a residential care facility or an acute care facility, you're part of the Hospital Employees Union, so your pay is usually around $21 to $23 an hour, depending on what health authority you work for. So in the acute care situation, you often need an acute care certificate, which is an extra 2-month course offered by a number of institutions throughout the province. Either that or you need at least a couple of years of experience working in residential care. It really depends on the health authority. The nurses union is definitely not pleased that there are a lot of care aides working in hospitals, but it is a reality of an aging population, and care aides are very well trained, and I think a real asset to nurses and to the healthcare system to have them working in acute care. But as I said, reporting to their nurse is really important. So everything that they do, they report back to the nurse. They report if the patient had a bowel movement. They report, anything out of the ordinary. If it has to do with behavior, if it has to do with just a little shake, or they're inspecting the skin and notice a little red spot. That's all being reported to the nurse. And I'll just finish with these job duties. So activities of daily living. So you're helping people get around from place to place, ambulation. If they're using their walker, if they're getting into their wheelchair, making sure that they don't fall. You're helping them groom and dress. You are performing bed baths, which is what we see in these two pictures here. And I just love this picture here because this is the most important part of being a care aide, and that is connecting with people. It's not just about making sure that this person is bathed. It's also about connecting, a human-to-human connection. And here we can see another really important part of a care aide's job, and that's to inspect the skin. So she's bathing him, but she's also inspecting his skin for any bed sores or breakdown. You're doing a lot of the job is performing pericare, which is a fancy way of saying cleaning people's bums. And I honestly, when I first started this job, I didn't think I could do it, but it very soon becomes no different than doing the dishes at home. It's just you do it, you get it done, and it doesn't bother me one bit. And the first time I had to do it, I never thought that I would say that. So and helping people with mouth care, assisting them to the toilet, and assisting them with feeding, which is much more complicated than I ever realized. It's not just sticking a spoon in someone's mouth. There's a lot more to it than that. And again, care aides receive extensive training with this. So that's your job as a care aide. And I encourage you to look into it more if any of this appeals to you.